Good Wednesday afternoon, and thanks for joining us. I'm Charity Menifee, the Director of Communicable and Environmental Disease and Emergency Preparedness at the Knox County Health Department. Our moment of gratitude today is dedicated to our businesses and employees who are eager to get back to work, but are diligently following the reopening guidance to work towards keeping both employees and the public safe. Anecdotally, we are hearing from our partners who frequently talk to businesses about several innovative business practices or plans that have been put together in a responsible and meaningful way. For that, we are grateful. We are also aware of some businesses who are choosing not to open right away in order to better prepare, and we are thankful for those businesses as well. Remember that Friday is the earliest you can open in Knox County in Phase 1, but you're not required to open on Friday. We continue to be appreciative of our businesses and employees who are such an important part of the fabric of our community, and we trust you to do the right thing for your organization. We are continuing to build out our website to provide more information and resources for employers to utilize as they prepare to reopen their businesses. You can find those resources on our website at covid.knoxcountytn.gov/reopening. Again, that's covid.knoxcountytn.gov/reopening. Later this week, we will spend some time walking you through our website and the content that is available at that time. We've been getting a lot of questions about the differences between the state's reopening plan and our local Knox County plan. Under the state's plan, Metro Health Departments, like the Knox County Health Department, are empowered to create strategies relevant to the unique needs and local situations in our communities. If there are differences between the plans, the community should follow the local plan. However, as we explain in our plan on the very first page, there may be times that additional federal and state guidance is released that require amendments to our plan, and those may be issued if they're needed. As an example of that, there is guidance right now for the faith communities that the state is creating. Specific to the Executive Order 30 that the governor announced yesterday, there are no local orders allowed or permitted for the faith-based communities. So our recommendation at this time will be to follow that particular guidance when it is released from the governor's office. Once we receive that specific guidance from the governor, amendments will be made to our local plan as well. Moving forward, this will continue to be part of the challenge as our plan was created before the rest of the state guidance was made available. We had been encouraged to create our local plan and given the authority by the governor to do so, and we wanted to do that as early as possible. We did this because we knew businesses in our community were eager to receive guidance as it related to reopening, so they had time to plan. We understand that this can be confusing, but we will continue to update our plan on our website with any changes, and the website will have a section with added updates to the plan so that the public can be sure they are looking at the most up-to-date guidance. Moving into our local situation, we have 224 confirmed cases of COVID in Knox County. 197 of those have recovered. 34 individuals have been hospitalized at some point in their illness, with 3 currently hospitalized. And we are thankful that we have no additional deaths due to COVID-19 at this time. And now I'll open it up for questions.
Please go ahead and submit your questions now. All right, we'll get started here from the Compass. According to the KCHD website, Hispanics make up 12.95% of the positive cases, but account for only 4.4% of the county's population. What does that indicate about the spread within the Hispanic population? And is it the result of one or more clusters at a particular workspace, residential complex, or places of worship?
I think that does reflect, again, let's go back to that we have relatively small numbers, and so getting percentages out of those is really challenging to do, but we are providing those to be open and transparent for you on the website. The higher numbers were related to a family group essentially, for the most part, for a lot of our cases within that community. And so there's not a large cluster in a business or anything like that we're concerned about at this time.
From WBIR, they say from a Channel 10 viewer, according to the CDC guidance, if a physician suspects a patient who has passed, possibly had COVID, they are to list the cause of death as COVID. That case then is counted as a death. Does that also get added into the positive category as well?
Okay, so that would get added into the positive category, and we will get those notifications. We get notified from the State Department of Health when those notifications are made. They report those to us as well. So those would get added into our deaths and our case count.
From WBIR, how many different strains of coronavirus are currently or typically seen in our area this time of year?
I think there's about 4 that normally circulate in the community. The last number that I saw early on in this of normally circulating coronaviruses that are different from the COVID-19 version that is causing this pandemic.
From WBIR, is it possible due to other strains of coronavirus that there are false positives in the COVID-19 test?
Not for the confirmatory test that we are using, which is the PCR test that we've talked about, which is polymerase chain reaction test. That is looking specifically for the COVID-19 version. There are some questions about antibody testing, and a lot of that's still up in the air right now, and we're waiting on more guidance for that.
Has COVID-19 mutated?
Well, the coronavirus mutated to become the virus that became COVID-19. So, and that's what's allowing it to become a pandemic. So it's changed enough that it's different from our bodies being able to recognize it as one of the normally circulating ones. But I'm not sure what you're getting at. If I didn't hit on that, if you want to provide more clarification, you can.
From WBIR, has KCHD received any of the tainted tests from the CDC?
Again, probably need some specific context. There were some, I saw some reports very early on about some tests that were not available or weren't accurate very, very early on, and that had been reported, but I haven't seen anything recently.
From the Sentinel, what assumptions is your mathematical model for effective transmission are based on?
So we were utilizing various models. There's a lot of different models that we have worked with our hospital community and public health is using to look at. They vary. There's everything from the IHME model to the Vanderbilt model and many others. And what we're trying to do is kind of keep an eye on various models. We do want that our transmission to stay low. We don't want to see a lot of people infecting other people. And so that's what's important. But we don't rely on one model at this time.
From the Sentinel, as a follow-up, Vanderbilt has said our model, the effective transmission model, cannot accurately gauge East Tennessee's effective transmission because there is inadequate testing. How much testing are you planning on doing in the coming weeks? Do you think that will be sufficient?
Our testing is going up all the time, and I think that it is painting a good picture of what we're seeing. We're also not seeing a lot of cases in our contacts as we're getting those people tested more and more, but testing is increasing frequently. We're actually working on gathering more data on that as we've been talking about, so we have a better picture of that. But alone, our testing has gone up dramatically just in public health. We've tested, I believe, well over 1,500 people, I think, this month.
From WATE, what would you tell the businesses who are wary to reopen? And what would you tell customers who are wary to start using services again?
I think this goes back to that personal piece. So if the company doesn't feel or the business doesn't feel safe to reopen, then they shouldn't at this time. That is completely up to them. Our path that we're taking is really trying to provide guidance that can help them do it safely when they are ready to do so. So again, we're not telling anybody that they have to reopen. We just want to help them when they are ready to do so, and we are ready for them to do so. And the same thing goes for individuals. I think that if you aren't comfortable, then we're not telling you have to go out at this point in time. You know, we want you to make the decisions that are best for you moving forward.
From WBIR, what is considered recovered? What are the criteria? We have been contacted by a man claiming to have had a positive test for COVID-19 and has been deemed by the health department as recovered. despite still having symptoms that are listed as possible COVID-19 symptoms per CDC guidelines?
Okay, yeah, so recovered means, and I think there's a difference. So being positive for COVID-19 is different than being infectious. And so the time frame that we look at for being infectious is where we look at up to 10 days max. Typically, is what the data that we've been seeing says. So our end of the our guidance for that is 7 days from their point of their test or their onset of symptoms if they have symptoms, plus 72 hours fever free. If we don't have any guidance, we'll go as long as 21 days. If we don't have any of their symptoms or any information, we'll go as long as 21 days. And then we pull them out because there's no evidence at this point that shows that after 21 days that you would still be infectious. So it is possible to still have a lingering cough and some leftover side effects. But if people aren't feeling bad, if they're not feverish anymore, if they are improving in their health and they've met all those other guidelines, then they're released.
From WVLT, how many total cases of COVID-19 are in Knox County nursing homes?
I am not aware of the details on that right now. Specific to a nursing home, what's on the website is what's out there that we know that we're aware of right now.
From the Sentinel,
that's the state's website. Sorry to interrupt. The state's website.
From the Sentinel, are you aware of whether area hospitals have taken a financial hit because of COVID-19? Any idea on how much they have lost? Again, we try really hard not to speak for other organizations, but I think that it's not out of the question that there would be a financial hit when they have not been doing things like elective surgeries and things like that, that bring in money into the organization. And so I think that it's not out of the question, but on specifics on what that is or how much it is, that needs to go to the hospitals. Follow-up question there was, does that impact their ability to reopen and resume operating?
Again, that's a great question for them. They do have a plan that's out there and that they're working, and I think you need to ask them that question.
From WBIR, is the health department hiring contact tracers? How many do we need?
There's a lot of different models on that as well. We have a team dedicated right now, and we have the ability to expand that team with our internal Knox County team members to get more help with that. The state can also provide support if needed. One of the gauges on that, one of the recommendations is up to 15 people per 100,000. And we feel like we can meet that measure with contact tracing, data analysis, investigations. We aren't planning on hiring any additional staff at this time, but we could if we need to.
Also from WBIR, in regards to gyms, can COVID be spread through sweat? When working out with a mask, are there health risks associated with a decrease in airflow due to the mask? So COVID is spread through respiratory droplets. So that is the first thing to talk about on that. So we do encourage that everybody be disinfecting frequently and following the guidance that we provided for gyms to try to create as safe as environment as possible for them. Regarding the safety of wearing masks, that's going to go back to the individuals. We want people to be aware of the risk that's associated with that. If they don't feel like they can exercise safely with the mask, then they shouldn't do so in a gym environment. From the Sentinel, yesterday, in reply to a question about enforcement, you continually brought up education as a first step for non-compliant businesses. Knox News has published several articles about non-compliant, non-essential businesses, and we have heard from workers that not all employers take COVID or sick leave seriously. We want to know what specifically are the other steps in enforcement. What penalties, fines, or other actions can you take? Okay, so we talk about education because that's really the thing. And let me put this in context of it. We investigate literally thousands of cases of infectious disease every single year. And we also work with outbreaks, probably 12 to 15 every year with businesses and organizations. And the vast majority, and I mean vast majority of things that need to happen when we just educate, whether it's a person or a business, on what they need to be doing to prevent the spread of whatever the infection is. So from there, if we have issues, and we do this all the time, again, this is not with just COVID, but anything, and we do this regularly when we need to, which is not often.
we can move to what's called a health directive, which is what Dr. Buchanan mentioned yesterday, which is essentially a letter spelling out what we need the individual or the business to do to prevent, to stop spreading disease or whatever other actions need to be taken given the situation. So that happens, again, in the small amount of cases when we have to do that, that usually stops it. If that cannot happen, if that doesn't work and they move on and they keep spreading, having situations that could spread disease and affect the public, then we can move into what's called a health measure. And that's with Dr. Buchanan working with our a judge essentially to make an order for that person or that business to follow the directions that have been given by public health. And if that doesn't happen, then that's when further legal action can be taken as far as, you know, whatever that may be according to what the judge decides.
From WBIR, is there any sort of protection in place for employees who don't feel safe going back to work, maybe because they're immunocompromised or have family with immunity issues?
We really encourage, and in a plan, I think we talk about this, that we encourage businesses to look at those situations with their employees and work through those issues and be understanding as much as they can of those situations as they arise. We don't want people that are at high risk to have to be around a lot of people that could help affect their health. And so we really encourage those conversations to be had between the employee and the employer.
From WATE, the KCHD plans mentioned signs being available to businesses. What will those signs look like? They're
actually on our website now. And again, later this week, we'll be walking through that, but they are available on the website that I listed earlier today.
And does the health department have to check out the business first to know they are in compliance with recommendations before getting the signs?
No, as we say, we cannot review every plan for every business. We do have a team that will help provide guidance on that. You do have to sign up to get information. We want the signs posted, and so we want you to continue to follow those. Those are things talking about if, you know, asking if people have been exposed to the disease, not letting them in if they need to, or if they are sick themselves are the main things that we're looking for at this time.
From WBIR, any update on antibody testing by the county?
Not this time. There's actually just a Tennessee Health Alert Network message that was put out to us. Actually, when we were prepping for this, I haven't had a chance to read it on antibody testing. And so we might have more information in the near future, but I did not have an opportunity to read that before walking in here today.
From WATE, are gyms allowed to offer group classes?
I would have to refer to the plan. No, I don't believe so at this time, but there's a lot of stuff in the plan. So again, refer to the plan on the website and it's spelled out in there, I know clearly.
From WBIR, historically, would you consider this the largest public health emergency the Knox County Health Department has had to deal with?
Absolutely. This is by far the largest, which is why there's so many different things that are happening that we haven't had to do before. So, you know, closing the whole communities and businesses and all of those things. Absolutely the largest that we've had to respond to.
From the Sentinel, what metrics or thresholds specifically would trigger a reversal of the current phase of staged reopening?
So there's not a specific metric or a lone metric, and this is discussed in the plan as well that you can look at. It's really looking at the entire situation, but the metrics that we are looking at that are explained are our new case counts and what those look like, the amount of testing. We don't want to see a downward trend in testing that's being done, the ability of the public health folks to respond to new cases and track contacts and monitor folks. What our health care system capacity looks like, and then deaths as well. And there will be metrics available and information on our website by the end of the week for those measures as well.
Also from the Sentinel, in the event of a significant outbreak of coronavirus larger than what we've experienced so far, what would trigger the health department to impose stricter orders than we have previously seen?
I think that would be back to what I just said. So it's looking at the picture. So if there's, and this goes back to the stuff that we've talked about before of how we do our work normally. So if we see a lot of cases that are in one specific area and one large business, for example, and we can get in touch with all of those people and we can trace them and get them into quarantine and do all the things that we need to do to protect so there's no additional risk to the public from that group, that might not cause a change in our plan. But if we start seeing a specific sector or there's other things that we had not anticipated that start happening, when we look at the whole picture, that's what would make us revert if we need to. And we hope not to. And I think that goes back to, we really encourage everyone to follow all of the general guidance that's in the plan. The keeping the social distance, the staying 6 feet away from each other, wearing a mask when you're in public, washing your hands frequently, don't go out when you're sick. All of those things, if they're done well and thoughtfully, will help keep us kind of below that curve, keep that curve flat so that we can keep moving forward.
From WATE, should businesses be taking customers' temperatures?
I think that's in the plan, recommended for different places, and it's one tool in the toolbox. So again, we recommend that you follow. There's a lot of general guidance that applies to everybody, and then specific guidance for different types of organizations. Look at both of those things to make your plans, but that's just one tool.
From WVLT, how many first responders and medical staff have tested positive for COVID-19?
I do not have that number in front of me at all, or in my head either.
Any other questions? Please go ahead and submit them now. From the Sentinel, the CDC defines recovered at-home patients as resolution of fever without the use of fever-reducing medications and improvement in respiratory symptoms and negative results COVID-19 from at least 2 consecutive nasopharyngeal swab specimens.
That's old guidance, the negative test results. That is not a policy anymore because there can be lingering symptoms. So the more current guidance is what I said, which is the 7 days, 72 hours. That part is correct. 72 hours without fever reducing medications, in general, feeling better. But the negative test can be positive for a long time. Like I said, when you're not infectious, it takes a while for those to clear out. So that there's more current guidance than that.
Any other questions? Please go ahead and submit them now. Follow up to the Sentinel's question. He says the patient in question has been on over-the-counter fever reducers.
I can't talk about specific patients, and I don't know that specific case. We can look into that, but that's the guidance that I've given you is what we're following at this time.
All right, any other questions? All right, no other questions, then we will be with you tomorrow at the same time. Thank you all for joining us.